Hi everyone, I am Dr. Shahan and today in this video I will teach you about leptospirosis. Leptospirosis is an infection. Basically it comes from the rat urine. Very important is this term rat and urine because they will give a case and there will be rat urine, rat is there. So you will understand it is leptospirosis. And leptospirosis, they will always give a case of sewage worker, sewage worker, drain cleaner, drain washer. All these things will be there. So remember, drain worker, sewage worker, the case is leptospirosis. It occurs due to a spirochete. The name of the spirochete is Leptospira. It occurs due to a spirochete. The name of the spirochete is Leptospira and it transmits to the human beings. Now look at the black color box. You can see how leptospira, the spirochete, looks like. How the spirochete looks like, you can see here. Can you see the coiling? Yes, there is coiling and you can see in the black background that is leptospira. That is a spirochete that causes leptospirosis. I will tell you in this video what are the symptoms. So watch the video continuously and do not skip the video. Look at this picture. Why I have given this beautiful slide. You can see a rat. Yes, you can see a rat. You can see urine, rat urine, and you can see water. So rat has urinated in this water, and when you are walking barefoot and there is a cut on your or wound on your leg, on your foot, then generally these leptospiras, which I make you see, that actually enters through your wound and basically you can get leptospirosis. You can get the disease leptospirosis. Now look at this slide. This slide we will see the symptoms. What are the symptoms we will get? Basically we will get normal symptoms just like others, fever, chill, headache, all these things you will get, like vomiting, loss of appetite, muscle pain, redness of eye and cough. But the two important symptoms which I will stress, because whenever they will give a case of leptospirosis, they will give conjunctival congestion. Look at the conjunctiva. Can you see in the lower side, lower right side, you can see conjunctiva, the eyes. You can see the eyes, conjunctiva, the eyes are red. Basically the conjunctiva has turned into red color. So you can see conjunctival congestion. And very important, another feature is your calf muscle pain. Muscle pain is important, but remember, calf muscle pain, they always give in the picture. So these two things you have to remember. Other features are just like other diseases like fever, chills, headache, any disease you can get, vomiting, loss of appetite, muscle pain. But remember, the muscle in the muscle pain you have to remember the calf pain. Calf muscle, which muscle pain? Calf muscle, they always ask you. And conjunctival suffocation, conjunctival suffusion you can get, so now look at this slide. This slide is basically showing you the source of infection. From where does this leptospirosis disease or the infection came? Basically it come from animal reservoir. There are animals which act as reservoir. What do you mean by reservoir? It kept the leptospira inside them. That is animal reservoir. Basically we get the infection from excreted in the urine of infected animals for a long time. So when there is excreted urine of an animal is there and it is infected, you can get from the urine the leptospirosis. Generally the sewage worker, the drain worker, the drain cleaner, basically they get exposed to the rat urine and they get these infections. And rodents, mice, all this, domestic animals also, sheep, goat can also have this. Now look at this picture. Why I have shown this picture? This picture is showing you the conjunctival suffusion. Conjunctival congestion is there. Can you see the conjunctiva? Yes, it is red coloration. You can see it is red coloration. So this is very important feature of leptospirosis. They have recently given in a case of leptospirosis basically in the NEET PG, and they have given a case of a sewage worker with conjunctival suffusion, conjunctival congestion, suffusion is there. You can see how the red coloration in the conjunctiva is there. When you check the sewage worker's eye, you can get congestion, you can get suffusion of the conjunctiva. Conjunctiva is affected. When you see this, you can understand this is a patient of leptospirosis. This is a patient of leptospirosis. This is very, very important. Now look at this picture. This picture is showing what? It is showing you the radiological picture. Yes, you can see the hepatosplenomegaly. You can see hepatosplenomegaly. Hepatosplenomegaly is also very, very important feature for leptospirosis. It may or may not be present, that is different thing, but generally in leptospirosis you can get hepatosplenomegaly along with a very important thing, that is renal failure. Along with renal failure is there along with hepatosplenomegaly. So whenever there is a question of a sewage worker or a drain worker who is having hepatosplenomegaly and having the renal failure, hepatosplenomegaly, renal failure, along with that they may also give conjunctival suffusion, you will think of leptospirosis. Now look at this picture. This picture basically shows you the conjunctival suffusion. I told you I will show you picture. So see this conjunctival suffusion, and there is also rash, petechial rash. What do you mean by petechial? Small dot like, you can see petechial rash is there. So petechial rash, conjunctival suffusion, these are very, very important characteristics. That is why they always, whenever they create a case on leptospirosis, they will say about the conjunctival suffusion. They may also say about the petechial rash. And another very important characteristic is the muscle pain. Which muscle pain? Which muscle pain? Very important, calf muscle pain. So if they give you a question on leptospirosis, that is there is a sewage worker who is having the calf muscle pain with conjunctival suffusion, you can easily now answer that is leptospirosis. That is leptospirosis. Now look at this picture. This picture is showing what? The leptospira. This is showing the spirochete leptospira. You can see how they look, and basically they look like this in the black background. They will give this picture also. Sometimes they ask image based question. You can easily understand this is leptospira, which actually causes the leptospirosis. And sometimes they also give you a history of a rat urine, infected rat urine, and sewage worker case, conjunctival suffusion case, or you can also find out the calf muscle tenderness, myalgia, fever. So you can understand this is leptospira, and this picture is there. So you can easily understand it's caused by leptospira, leptospirosis. Why I have taught you, this is very, very important for your NEET, PG, FMG and INISET examination. These diseases will be asked every year. Every year they will ask you question on this. So if you like this video, make a thumbs up and please subscribe.